Oh,
Oh,
okay. Well, I guess it started already.
well, I can.
Yeah, okay, now I see the page. So this is more like a conversation rather than a training or an in-service, I guess. We're going to discuss. I know that your facilities, they're going to be getting some consumers or a consumer that identifies as transgender. And so we just want to kind of prepare everybody for that discussion. I'm Marche Lewis, the program director of the Targeted Case Management Program at Genesis. I'm not transgender. However, I'm an ally. And part of my research work when I was in graduate school 10 years ago was working with transgender people of color and on their resiliency factors. And I learned a lot of my own kind of biases and ignorance that I had. It kind of, I was confronted with that. And so a lot of questions that I had, a lot of things that I didn't know that I was doing that contributed to transphobia, the institution of transphobia. I realized that I had to change. And so I've learned so much. And I've considered myself, again, an active ally ever since. And so this is basically just kind of discussing, some basics for how to approach this new consumer, new client with your staff to make sure that there's a, level of mutual respect. Can you guys see everyone can see my slideshow up there? Just want to make sure.
Yep.
And Marcia, this is a little different too, because in the past we might have had individuals who had female genitalia but identified as male, but now we actually have, and it's a female house, and now we actually have somebody with male genitalia who identifies as a female. So it's a little different than what we've had in the past.
Okay. And so a transgender woman you'll be getting soon is what I'm hearing.
Yeah.
Okay. And so just to start, I just want to know like your, a little background, what position you guys have and how you work with the staff underneath you when it comes to dealing with new admissions.
Okay. Well, first of all, let me just say my co-counselor is out sick today, so it's just me. Well, the process is usually that when the intake is done by the resident assistants, and then they usually will have their assessment done with either Sarah or Deanna, I believe is the other person that does the assessments for us. And then I think the first time they actually have a sit down with one of us is to do their treatment plan. I do have experience in working with a transgender woman in a residential facility. This wouldn't be my first time, and neither would it be Dominique's first time either. So we do have experience with this.
Great.
Yeah. And then pretty much we just call them by the name that they would like for us to, their respected name. We don't discuss with other clients anything about any questions that they have. We don't discuss that with other clients. And we just proceed with giving them the information and the tools that they need to, learn how to recover. So that's my experience with working with transgender client. I've only had one, but yeah, that was my experience. And I learned a lot too by that one client. She taught me a lot.
So in talking to Patty too about this, so this individual is going to have a private room because many of our rooms are shared occupancy. So this client would have a private room. And Patty was saying something about having their own bathroom, but we have transgender clients quite frequently at Detox. And what we just do is say, their clients are not allowed in the bathroom with each other anyway for various reasons. So it would be the same for this individual. They could not be in the bathroom with any other client.
Yes. Yeah, we just have the two bathrooms because we have like a duplex setting. So the house upstairs has one bathroom, the one downstairs, and usually the ladies shower and use the bathroom. It's only one person that goes in there anyway. So yeah, so it's kind of.
Sounds like you guys are already prepared. And so I don't want to be offensive with some of the background information in the training, because it was kind of prepared for people who may not have had any experiences with transgender clients. Just so you know, I want to give you that heads up. And I think I'll go through it with that presumption just because you guys will show it to employees.
Okay.
So, and Robin, are you still there?
Yes, ma'am.
Okay, so which position do you have? Are you at the same location as Roxy?
No, I'm at Crossroads. I'm the program coordinator here.
Okay.
And I don't have a lot of experience with transgender. I had it in TLP, but obviously that was a few years ago. So I'm sure in-house things are a little bit different. So I'm excited to learn more about it.
Okay, great. Good. So again, we're gonna take this as if we, this is a newer experience just to prepare the other staff. So my question initially when Deb approached me with the possibility of this in-service was, why do we need this training? And the reason why is because I was confused. I'm like, well, it's 2021, everybody, in my mind, I'm like, everyone knows someone who's transgender. Everyone's worked with someone who's transgender, in my opinion. And I remembered that's not the case. And I was coming from a position of biasy in the fact that I just assumed like this is just a basic. But I have to remember, people are like the combination of their own personal experiences. Some people, they bring religious beliefs into the workplace that they can't even help. They don't mean any harm. They bring social experiences into how they deal with clients. And so they might not mean any hurt or harm with some of the things they may say or do, or the wrong pronouns or whatever, but we still have to, I guess, remind everyone how important it's not just a legal requirement to respect someone who is a sexual minority, but it's an ethical responsibility that we all have as clinicians to our clients. And so I did want to share not a whole video, but part of this video that kind of tells you exactly why I think it's important for us to remember why we have to train on these subjects. Can you guys see this video right here?
Yes.
It's like loading, okay.
Hey everyone, today we're talking about a pretty heavy topic that has to do with suicide in the trans community. I'm just warning you now, there will be a lot of discussion of transphobia and suicide in this video. So if you don't want to hear about these things right now, feel free to click away. You're under no obligation to watch this video. I totally understand if you don't want to or can't right now. So here's the problem. Trans people have a vastly higher attempted suicide rate than the general public. Today I want to examine why that is and what we can do to bring that rate down. In the process, I also want to dispel some highly publicized myths about the trans suicide rate. To do this, I'll be citing a lot of scientific studies, and you'll be able to find all of them linked down below if you'd like to go have a look at them yourself. Because as much as transphobes like to pretend that they care about science, all of the scientific research out there backs up what I'm about to tell you. All right, so the general population in the US has a lifetime attempted suicide rate of about 4.6%. It's important to note that this is a lifetime rate, so you may see smaller numbers quoted when people talk about
Can't hear anything.
No.
I can't hear.
Yeah, all of a sudden, well,
I'm sorry, you said you guys can't hear the video?
right. Can you?
So yeah, I can hear it, but I don't know how to change that. So what I do want to say, the purpose, we actually, already got to the point of that one. I apologize.
Okay.
It was kind of to tell you guys the purpose is like at the core of what we do as providers. whether you're a nurse or a counselor or a therapist, is that we have a duty to do no harm or prevent harm for as much as possible. And so to find out that the overall percentage of adults in the general population that commit suicide is 4.6, and the rate for people who are transgender who have tried to commit suicide is 40%, is astonishing. It's unfortunately not very surprising, but it's like when you really look at those numbers, that's 10 times the amount that the general population go through. And what I learned from my previous research with transgender people of color was that a major resiliency factor was having a network of support around them and people who cared about their well-being and who valued them and humanized them and made sure that they felt like they were good enough and that they deserved to live. And so that's the whole purpose, is just making sure that we give them as much love and support as possible to prevent them from becoming a part of that number, that 40%. And so if you look at the purpose of the in-service, it's pretty much that simple. I thought this was an interesting graphic because a lot of people want to know what the whole alphabet is, and you might actually find yourself on the alphabet. Again, one of the A's, this is the most updated one. A lot of times you might see LGBTQ or QIA+, but this is one of the most updated ones. And so it has not just, lesbian, gay, bisexual, and transgender, but they include transsexual. And I want y'all to know the term transsexual is kind of outdated, but you might hear it every now and then. And so what it initially referred to is basically people who either had some type of work done to alter their genitals to match how they felt or what they identify with sexually, or they were planning to. Whereas a transgender, they just felt inside themselves that they were of a different gender. So so that was the difference, but nowadays you don't hear the term transsexual used too often, I would say. Queer is just kind of like, just a unique term for people who don't necessarily fit into the box of any other letter. And then again, one of the A's is the ally. So usually they're non-queer people who support and advocate the community. A lot of us have friends or relatives who may belong to one of these other letters, and just the fact that you affirm them and let them know that you care about them despite what they do and who they love makes you an ally, whether you know it or not. And some newer ones, the term asexual has been around a long time, and a lot of people don't understand it, but basically they have no sexual desires for any particular person. And then pansexuals is like the polar opposite, where they're attracted to you regardless of your sexual makeup or your identity. So next, so these other slides, we won't go through like word by word, but just kind of to give you an idea of some of the concerns. The main concern, of course, is transphobia. And when we hear the word phobia, we think fear, and we're like, I'm not afraid of, a person just because they're transgender, or I'm not afraid of a person just because they're homosexual, but really more so transphobia is about the hatred and the disdain that some people have for people who are transgender. It might be a disgust, it might be a complete dismissal of them. That qualifies as transphobia again. And as you can see on the slide, it can take different forms. It can be in your attitude. It can be on, a lack of understanding or a desire to not even try to learn anymore, because you're just like, that's them, and I don't want anything to do with them. They're, kind of like how some people might have grown up in a household where it was like, we don't talk about that. Those types of ideals contribute to transphobia. And it creates subtle and overt types of discrimination. Do you guys know like what microaggressions are? The best way that I can describe a microaggression is those tiny little subtle offenses that we go through every day as people, whether it's, seeing a magazine and you don't see anyone on the cover that looks like you, whether you start at a job and everybody else appears to be fully able, but you might be in a wheelchair. Whether it's little comments like, oh, you speak pretty well, like they're surprised that someone that is of color speaks well. Or, it's just those little comments that people don't even mean any harm with. They kind of break you down every day. And as a person of color, I can say that I know what that feels like. So imagine being a person who is constantly reminded that something's strange about them, that they hear terms all day long. They don't see people that look like them on television or on billboards, on commercials. They don't show as much transgender individuals as we would think. It might be it's probably better than it used to be. I won't lie and say that, but it's not representative of the general population. And so those reminders that you aren't represented, it tells you that you don't belong. And so you're constantly being reminded in your head, well, maybe something is wrong with me. Maybe something is different. Maybe something is disgusting. And those negative thoughts, those negative confirmations of who you are, it contributes to that mental illness, that depression that can lead individuals to suicide. And so that's why they suggest reaffirming people. So if you're at an office place and you might have some photos with people of color, you might have some people in wheelchairs, you might have different able-bodied, every type of representation you can find. I say include a rainbow flag, or include a bisexual or transgender flag, which is pink, white, and purple. Include something that's subtle. It doesn't have to cover the whole door, but it just lets them know that we acknowledge you and your existence is here too, whether we point it out. We're not going to say, hello, look, there's the flag right there. Come stay at this place. It's just going to be a sign like, oh, just like when I drive down certain neighborhoods that I see as wealthier neighborhoods, and then I see that they have like a Black Lives Matter sign on the lawn. That kind of makes me feel a little bit safer. Do you guys know what I mean? Like, it kind of makes you feel like, oh, I've seen it a couple of times where it's like, I wouldn't expect that a neighborhood in this area with such a small Black population would even have a sign on the door or on their lawn that represents the people that I relate to. And so I do suggest that at the places, if that's something that you guys have. If you don't have bulletin boards that have photos and stuff like that, you don't have to switch things up. But if you do, please be inclusive. So transgenderism, I won't go through this entire slide, but just so you know, transgenderism just refers to the whole ideal and the whole umbrella of being transgender. Previously refers to as transsexualism. People in the community may still say transsexual, but it's considered archaic. People don't really use that term in documentation as much anymore. And if you see it, it's usually probably an older document. But so basically at the core, they believe that they were born the wrong gender. And we all know that there's a difference between gender versus sexual orientation, which we'll get to in a second. They don't know the cause of it. It isn't a demon. It isn't a spirit over you. It isn't, there's nothing that they can say that points. They haven't been able to find it in a brain scan or in anyone's blood work, why some people are transgender versus cisgender, just like there's no part of the brain that really shows homosexuality. It's just a part of who you become. They definitely experience more distress or impairment in social, occupational, other areas of functioning. Just imagine living your life every day and not feeling whole. That's what I try to relate to that. And if you can keep, even if you don't know any transgender people in your personal life, just kind of remember the ideal is that they are a human being having an unusual experience in this world. And so we want to treat them with some type of, just decency and kindness, because it's already hard enough for them. So treatment for transgender individuals should focus on assisting the patient to achieve greater congruence between their outside appearance and internal gender identities. This is important because there used to be something called conversion therapy. And you know what? There still is. And unfortunately, in the news, a young man actually passed away. It was a transgender woman, a teenager, who her family actually put her through conversion therapy. It's rare, it's not clinically sane, it's not research-based or anything, but basically it's saying, we can teach you how not to be gay. We can teach you how not to be transgender, and it actually does more damage been good in the end. And unfortunately, the young lady ended up killing herself. And, you know, to add insult to injury with her situation, her parents, even in her obituary, refused to acknowledge the sexual identity that she had, that she literally died for. And so I want everyone to remember that we're not trying to teach someone to be what their sexual genitals are. It's not our place as clinicians to do that, and it's inappropriate, and it's unethical. And so just remember, who they present themselves to you as is who we respect them as. Again, this is a very long slide, but just so you know, one of the most important points here is the second point, where it says compared to the general population, adults who are transgender, they have higher levels of anxiety and depression, increased feelings of social awkwardness, distrust of others, greater risks from eating disorders, and a higher incidence of severe mental illness and substance abuse. They are at greater risk for violence, self-injury, suicide, and infections with HIV and other STIs. My personal experiences with working with transgender individuals is unfortunately because of the stigma attached to their identity. They have a hard time finding jobs where they can be themselves. And so a lot of them turn to sex work, when you see those increases in STIs and HIV, it's oftentimes related to, dangerous sex work activities that they're engaged in as a means to support themselves. One of the very first clients I've ever had was a young man who I met him as a teenager, and he started his transition while I was working with him, and was kicked out of his home by his mother, who believed that it was unchristian to identify as transgender. He was out on the street, he was homeless, he turned to sex work. Unfortunately, he ended up contracting HIV, and he became another young woman, because he does identify now as a woman. At the time he didn't. So he became another young woman of the transgender community who is struggling with that diagnosis, along with the mental illness factor, the isolation from his family, and the increased homelessness. Imagine if you have to legally use your birth name or biological name on documentation, but you present as a female. A lot of independent landlords, they have biases, they discriminate against people who don't fit what they're looking for on that paper. And so a lot of people who are transgender, they do have increased rates of homelessness outside of what other individuals in the community may have. And there's an underutilization and a lack of access to healthcare. So a lot of them, they live in shame constantly. And so they don't always seek out services. There was a time when I first started working in mental health, I remember I worked on the inpatient psychiatric unit. And at that time, you had to pass a psychiatric evaluation in order to be approved to begin hormonal therapy. And so a lot of individuals who may have had depression or bipolar disorder, or even something like schizophrenia, they were afraid to seek out treatment for their mental illness because they did not want that to show up on their record and deny them hormonal therapy. And so when we did have someone who was admitted on our psychiatric unit, I'll never forget, it was interesting because she was a young transgender woman. Her mother was actually a physician at the exact same hospital, but she had severe depression, and her depression led her to be denied access to hormonal therapy at that time. And it just was like a cycle. And so because she was unable to fulfill who she believed herself to be, she went further into depression, and she had more suicide attempts. And so she was always in the hospital, and her mother was always still, I'll never forget, referring to her by her male birth name and never acknowledged the fact that this was who she wanted to be. And so she just lived a very unhappy life. And I was very young at the time. This is before I did the research study, before I began working with individuals who were transgender. And I just remember feeling like this must be hell, to constantly be told that because you're mentally ill, that you can't have this medication, and then not having the medication contributes to your mental illness. So you're back in the hospital every month. And to have your mother, this very educated woman, who in my mind, she should know better, just reaffirming the fact that you're not who you believe yourself to be, and then not contribute to your mental illness. I don't know where this young lady is today. I don't know. All I know is that thankfully a lot of doctors have changed their laws and how they deal with access to hormonal therapy when it comes to mental illness. A lot more transgender individuals are exercising their right and speaking up for themselves. But back then it was different. But yeah, so just going back to the access to healthcare. So a lot of insurance plans did not cover, cross-sex hormone therapy or gender affirmation surgery. Another term for that is sexual reassignment surgery. But I guess the better term now that's coming into use is GAS, which is gender affirmation surgery. So you're starting to see it more. There's some places where even Medicaid, depending on the state, will cover the procedures. This is new to me. This was a shock to find out these resources from talking to the individuals. The ones I've worked with, they have spent decades kind of, trying to smuggle each other. They would give each other birth control pills. That's what they would take on the streets, or they would buy it on the streets. They didn't have access to these services. And so it is a sign of the times that more and more insurance companies are covering these procedures and covering hormonal therapy. I'm not sure if the individual that's coming to your facility is prescribed any hormonal therapy as of yet. But I know now, even if someone were to go to prison and they're already being prescribed that, they have to be allowed access. And so that's a right that they have when they're in jail or when they're at a community facility as well, is that their insurance covers the medication. If it was prescribed to them by a physician, then they have to keep taking it. And hormone therapy has to be taken every day for the rest of their lives. If you take too long of a break off of hormonal therapy, you can almost see the results of your transitioning stopping or pausing. You can almost see it immediately. And so it's very important for them to continue to have access to their hormones. And then, of course, there's still a lot of discrimination, even in medicine. We see that all the time as minority groups, as loved ones or relatives of people with special needs. We see that even the most educated people in our society, who we assume to be physicians, they still don't have that knowledge base and understanding of you have to treat people with care and respect at the very core. You still see that. You still see people dying because they weren't treated with respect, unfortunately. And in the transgender community, this is no different.
That brings up an interesting point, Roxy. So we're going to want to make sure that if she's being seen by our telehealth provider, that we get an appropriate telehealth provider for her. And we can discuss that offline, because I really want to make sure that, she gets somebody who is very understanding of what she's going through.
Yes, Deb, I'm glad you said that. That's important to know, because a lot of doctors, they're still old school. They have their own biases. Some of them, they have their belief system that, again, we're a product of it. A lot of us don't mean any harm. It's just what we know and what we believe to be best. Some of us really just don't know any better until we're taught. I was one of those people myself at one point in time. Moving on, so here's some important terminology. So, of course, we already discussed the acronym, the LGBTQ+. It's a long acronym. It may get longer and longer over time. Remember, it used to just be like LGB. It used to just be LGB. I remember that from the 90s, I think, and then it became LGBT. And I think that that's a sign of growth, and it's a good thing. It's like, we don't have to remember every letter, but we have to remember to acknowledge people for who they are. It's that simple, but that's the acronym, and it changes over time, just as society does. What's important to remind people who are new to working with people who are transgender is that sexual orientation and gender expression are completely different things. I know a transgender woman who only dates masculine females. So she's only attracted to other women. She identifies as a lesbian. And for some reason, people have a hard time wrapping their mind around the fact that this transgender woman only dates women. They're not all gay. They're not. It's very simple. It's a completely different aspect. So you may have some who are attracted to male or masculinity. You might have some that are still attracted to females. You might have some that are bisexual. You might even have some transgender individuals who are asexual or fit somewhere else on that alphabet that we were going over earlier. And I think a lot of confusion goes with people just not knowing the difference between sexual orientation and gender identity. Gender expression is basically, so we all have these norms of how a woman dresses and how a man dresses. That is what this refers to. So even though it's like, I think about, I had a discussion with someone and we were talking about the fact that, well, at one point in time, men wore dresses. And he said, well, they didn't have many pants back then. And of course they wore dresses. But I was like, so who decided that only men should wear pants? At what point in time, who was the person to decide that? You know what I mean? And that's how it works with gender expression, is because at some point in time, society, people, very flawed individuals as we all are, decided that a woman wears this, a man wears that, a woman's hair should look like this, a man's hair should look like that. Women wear colors on their nails, men do not. So these types of norms and mores from our society, they show in the LGBT community as well too. And so you will see some conflict with them where they might say, oh, you know, you don't really look soft. These are some quotes, these are some terms that they use within the community, soft, or you don't look fish. Have you guys ever heard that term, fish? Mm-hmm. So fish, so let me tell you guys about the term fish. Fish, if somebody, like, let's say you're working with a transgender individual or a gay man, if they call you fish as a cisgender woman, that's a compliment. They're saying you look good, you're put together, it's a compliment. And so when they use that amongst themselves, that means you look as much like a woman as possible. Why they use the term fish? We know why they use the term fish, but it's not meant to be an insult, it's actually a compliment. And a lot of people I've noticed, because they associate fish with odor and smell. Like, they're like, why would you go? No, that's a compliment. Trust me. If somebody says, Deb, you looking really, like if a transgender individual says to you, Deb, you looking real fishy today. Please believe you look good. You look good that day. So a lot of times in that fish ideal is gender expression in itself, even within their own community. They fight. Some of them might say, oh, you look hard. That's referring to a transgender woman who hasn't fully transitioned to look the ideal feminine look. Like, so that's someone who maybe their hormones have taken a little bit longer to process. Maybe their features are a little more chiseled. Maybe they look a little more strong. Maybe their breasts haven't fully developed. So that's an insult. So never use that term when we're talking to our transgender client. They may use it amongst each other, but that's an idea of what gender expression shows. So again, fish is good. It's a compliment. Soft is good. When they start saying hard or brick, that means that you look as what they would determine a masculine identity, which as a transgender woman is not preferred. Now, if you were to get a transgender male, which exists, it would be the opposite. Transgender males, it's not as much research done on transgender males. They tend to transition more quickly, what I've seen with my eyes, appearance-wise, than transgender women. So I do know some transgender men who their gender expression is amazing. They have full connecting beards, they're real. They have muscular toned bodies, they have deep voices, they have low cuts. You would never know unless they told you. And I don't know if it's just how our bodies work or how hormones work, but their process seems to usually not be as long of one as transgender women. But they do face other issues with the fact that usually they're smaller in stature. And so, you know, sometimes it puts you, I guess, in a little more danger if you identify as a male, but you are more petite. I've seen that. Again, transgender, umbrella term, it refers to those with identities that cross over and move between the socially constructed ideal of what their sexual gender should be versus what they feel they are. So again, like I was saying earlier, they used to use the term transsexual just to refer to somebody who has had or planning to have work done to change their genitalia to match how they feel on the inside. We don't use that term so much anymore. We use transgender to kind of encompass the whole ideal. So trans is the term that you use for short. It's no longer acceptable to use the term tranny. At one point in time, it used to be okay. Again, they may use that term amongst themselves. That's fine. Just like we have terms within our own individual communities that we could use amongst ourselves that is unacceptable for someone outside to use. But we can't use it anymore. It's offensive to them and it's considered a slur. And so we would respect that and we would use the term transgender or trans. Cisgender is like a newer term that's become more popular. And so cisgender basically like you express and you identify as whatever your sexual genitalia was assigned to be. So basically, everyone on this live, we would assume to be cisgender, i.e. they were probably born, we were all born female, we present as female. I don't know if that's the case. I'm just assuming from just looking at us, like, so that's what they go off of cisgender. It doesn't mean necessarily that you're straight. It just means that what you were born as is what you identify as. And so it's not an insult. It's just a way to understand when we're having these conversations, who's on what, I guess, side, unfortunately. And so lately we've been hearing the term cis a lot more. Pre-op, so the individual that you guys are getting at your facility is considered pre-op. So she is a pre-op transgender woman. But I wouldn't even use the term pre-op. Some people are a little sensitive to it, but just so you know, it just refers to somebody who hasn't yet completed their sexual reassignment or sexual affirmation surgery. That's all it means. And post-op is after they've had the procedure. It could be top surgery. For a transgender woman, that means breast implants, or even hormonal therapy alone can produce breasts, full breasts. For a transgender man, it means the removal of the breasts, which is, again, another one of those services that some states Medicaid covers, which is a newer thing too. And then there's bottom surgery. They usually get their top done first and then their bottom done last. And so for a transgender woman, that would be removal of the penis. And they usually remove the, I don't know if this matters, but they remove the testicles first. They put them on hormones and then they remove the penis. And then they reassign and perform the reassignment surgery to create the vagina. I do have a friend personally who went through the whole procedure. So I've seen the process of her going from initially just having the hormonal therapy to getting the removal of the testicles, to removal of the penis, to getting finally the vagina done earlier this year. And it's a very expensive surgery to get to have a sexual reassignment surgery. It's very expensive. A lot of people may have gotten their top surgery covered by their insurance or Medicaid, but it won't cover the bottom surgery. And it can get into like the tens of thousands. And so she actually went to Thailand to get the procedure done. Thailand has been doing that procedure since the 70s. They're ahead of us on that. So in case you guys were ever curious or somebody asked you, they actually really, they're advanced when it comes to sexual reassignment surgery as opposed to America, where they usually can do the removal of hormones. A lot of people in the community, they say moans. They like, I have to make sure I get my moans. You might hear that term when the transgender individual arrives. She may use that terminology if she is on hormones. Again, this is important to make sure that she gets them continuously, because you can really delay your transition process if you stop. It doesn't take long for it to stop. So they have hormones for men who are transitioning to female, and hormones for females who are transitioning to males. In TERF, you know why I included the word TERF is because before we started, I was talking about have you guys heard about this Dave Chappelle special that he did recently? It's been in the news a lot, but I watched it and he used an interesting term that I hadn't heard before and I wanted to learn more. And it's TERF, which is trans exclusionary radical feminist. Basically, it refers to women who they believe in women's rights, they believe in women empowerment, but only for people who were born biologically women. And I guess the most well-known TERF at this time is J.K. Rowling, who wrote the Harry Potter books. She's been really outspoken in the ideal that gender is in her words, is a fact. And they can become offended by the ideal of transgender women receiving the same types of rights or acknowledgement that they have. And I just want people to be aware because it's an interesting term and it also is a nuance of how we are progressing in the way of feminism, but not in the way of transgender rights. And it kind of reminds me of, which he also said during the special, he brought a point to say that the feminist movement, as some of us know, initially wasn't intended to include Black women. And we had to make our voices heard within the feminist movement. And not to make a comparison between the civil rights movements of Black people and transgender people, but it kind of mirrors the fact that initially transgender women were not included in the feminist movement, and now they're demanding that they become a part of it. And so I think what we'll see over time is more of that conflict between transgender women and feminists. But it's a newer ideal. Again, if you guys haven't seen this special, it's poignant. I would recommend seeing it. It's on Netflix. I wanted to include a portion of it, but Netflix rights wouldn't let me go to YouTube and pull it up. And I won't say what opinion I have on it, but I know that it's very polarizing right now, and that a lot of people are on both sides kind of angry, but at least we're having a conversation. In my opinion, that's a good sign.
I'm sorry, what movie was that?
It's a new Netflix special with Dave Chappelle. It's called The Closer. I've always been a big Dave Chappelle fan. There were some things he said through the whole special that I kind of side-eyed, whether they were related to, lesbian rights, transgender rights, or racial concerns. It's very interesting. And so I would recommend it to kind of see what people are talking about. But that's where the first time I actually heard the term TERF be used. It's been all over the news lately. Again, terminology continued. It says my internet is unstable. Are you guys still able to hear and see me? Okay. Yeah. Okay, good. So as I said before, we don't use the term transsexual anymore. They may use the term within their community. That's okay. That's their right. We just don't use it if we're not a part of it. Drag, a lot of people confuse drag with transgender identity, which drag is basically just a person who dresses up in the opposite gender expression, either as entertainment, art, personal gratification. They may not even be gay. For example, RuPaul is not transgender. RuPaul is a drag performer. And so I think a lot of people that kind of melt those ideals together. That's why you don't see transgender individuals participating on his show, because it's a completely different category. It's also important that, like I keep saying, that while they may used to use slang terms or slurs against each other, we are professionals, we're clinicians, we're not a part of that group unless you are. Even if you are, use some words you don't use at work, or put in the documents. But it's just some stuff that we don't have the right to use, just as we, as individuals of our own groups, we don't allow other people, we would take offense. So just respect that fact that they have that right to determine what is acceptable to them at any given time. Like I said, it used to be a time where there were certain words that we said and it wasn't offensive. And then, they said, no, we don't like that. And we respect it. So this was a question that I had, and I was getting some information from Deb earlier. So separate showers, I know that you guys don't do separate showers, but you explained the fact that people don't shower together anyway, so this won't really come up. But just remember, in case some client, another resident asks, well, why, it's not because we're afraid of her doing something to you. It's just to respect her privacy. And that's important. It may seem very small, but that's important because there's these laws in different parts of the country where transgender individuals can't use the bathroom or certain. If that's not reminiscent of Jim Crow or other, or like even the Holocaust where Jews weren't allowed, like if that's not reminiscent of other times that were wrong, then that tells you a lot. It tells you a lot where they say you can't use this bathroom or you can't drink from this water fountain. And we should not be contributing to those ideals still, not in this day, in my opinion. So just remind everyone, if she does use a separate shower, if they ask, it's not because you're in any danger. We feel safe. It's just as a matter of privacy and respect. Again, maintenance of hormonal medications. Their medications are not a side thought. It's not a vitamin. It's something that is important to their identity. And so we have to respect that. And so I would just suggest finding out if she is on any before she gets there. If you could find that out from the DLC, because they're supposed to be giving them to her. A lot of transgender individuals have had their rights violated with hormonal medications. And so some people don't speak up that well for themselves and they don't know how to advocate and say that they have the right to their meds. And then they might need additional time to get ready for the day. There's some undergarments that some transgender women wear. I recall my family has these group homes. And so we had a transgender teenager, and she needed to be woken up a little bit earlier because it took her longer to prepare because she had to use, and this isn't an offensive term, but this is what they call it. It's called a tuck belt. And so it almost looks sort of like a jock strap. It is a specific undergarment for individuals who are transgender women that they may use to conceal their male genitalia. It's not a weapon or anything, but if you guys have specific rules for when you see it, if you feel like it's a safety risk, just explain that to them, that it's not because it's a specific to your gender, it's just a matter of safety. We did allow the young lady to use her belts at the house because it was part of her identity, because she was in a house full of other girls. She didn't want that part of herself exposed, and that was respected. It takes longer to get ready though. It definitely does. Just so you know, if she uses one. And some transgender men who haven't had top surgery done, they use binding, which basically is like the ACE bandages that wrap their breasts down. So that's an example of the other side of it, what you might see. So I will find out again from DLC or from her if she's on hormonal medication or if she uses any specific undergarments to control, her genitalia, however you want to say it. I would just say undergarments if you're not comfortable. And she'll tell you. Sometimes they might ask for tape because some people, they do choose to improvise with using tape, duct tape or masking tape. I don't even know if masking tape is, it depends, but usually it's duct tape if they don't have a belt. So again, how do you treat a transgender client? Is very simple. Like you treat everybody else. Like you're in this position for a reason, because you care, because you have compassion, and because you know that a human deserves respect and common decency. So it's kind of just reiterating how you treat everybody else. It's just essential that you maintain that respect. Like Roxy said initially, she said we call them by their preferred name. It wasn't something that has to be taught. She just knows we call them by their preferred name. Some people don't know that. They think, well, if it's on the legal paperwork, then that's the name we have to call them. That's the name that we pull on the bulletin board. If you guys have any, I'm sorry?
Well, previous to this, when we had somebody who identified, we had to call them by their given name. We could not call them anything but their given name, but now I believe they're probably allowing us to call them what their preferred name is. And the reason being is because of gang affiliations.
Oh, okay. I understand that.
It's my understanding, right, Roxy, that they want us to be calling, they previously wanted us to be calling them by their name on their, that they come with. But I think this time they're going to obviously allow us to call them what her preference is.
Okay. You're muted, Roxy.
Okay, so when we do their paperwork, we type in their birth name in their paperwork, right? Am I correct? Okay, we call them by their name, but all of their paperwork should reflect. Do we need to put their their name of preference like in parentheses or something on their paper documents?
I mean,
Because I
that's the
get that in
question we can ask Lisa, but
Okay.
because I know that like for insurances, whatever their given name is the name they have to use. And I'm not sure how the DOC, it'll be interesting to see when we get this individual's paperwork, how they identify this individual. And probably that will give us a clue as to what we need to do.
Okay.
And I would imagine you guys are probably going to be more progressive than what the DLC was, to be honest. So you probably will see that birth name on the documentation no matter what. Unless it just was some people that were more understanding, but traditionally they don't really seem to be as willing to accommodate people when they have special requests, what they consider a special request. I do know that like most paperwork, you're right, you do have to have the legal name. What we used to do, we would put the preferred name in parentheses and documents. But whenever it was like something, if there was like a bulletin board, something like, or chore board, anything like that, in public, we would use their preferred name, but in our documents, we would use their legal name. And then you probably like, if people get phone calls, it's always interesting too, because they come from families that might not, the family may call them by their birth name. You know what I mean? And they might get offended with you when you refer to them by their preferred name. And so that's an awkward conversation to have, just to let them know I respect what they requested. It's that simple. But that has come up. I've been a part of that with the young lady's grandmother calling and referring to her by her given name and asking me why I would even call her by a different name. And I wanted, of course, I respect her as her grandmother, but I have to respect her identity too. It's not fair for me not to do that as a provider. And so we just got to remember that. And so maybe if there's any specific legal paperwork, you want to make sure, I'm sure the medication prescriptions, they don't have her preferred name. They're going to have the legal name. And so that's what you go by. That's what's on the Medicaid card. But just when you're talking to them, just make sure the staff know, don't call her by her legal name.
And all the staff will have to take this training, Roxy. We're going to require it. And that's why we are videotaping it now. However, we've had like some more transgender females that have come to detox. And it's not so much the other clients that are a problem, but it's the staff that's sometimes a client. Because we had a transgender client come recently and they got all up in arms. They're like, you know, that's a male? Yeah. But, she has a right to be on the female unit because that is what she identifies as. So you might get more pushback from the staff too than you expect.
Mm-hmm.
And that's what I've seen personally too. I was surprised. I thought the other clients were going to give the young lady a hard time. No, it was the staff. Mm-hmm. And it was sad to say that it was the staff, and again, what I have to remind myself is like, they may not mean any harm and they may just not know any better. When you know better, you do better, the old saying. And if you give them the knowledge and you tell them, they still refuse to acknowledge, and that's a conversation that you guys have to have, because nobody should be continuously disrespected no matter what they want to do with their lives or their genitalia or whatever. Like, nobody deserves that. Just like if you had a preferred name, maybe there's some trauma associated with your name, respect is a mutual street. Call me what I asked you to call me. I'm not going to ask for a different name every day or something ridiculous, but just call me what I request. Mm-hmm. Same with their pronouns. You will hear them use like the term, I've heard the term, you don't respect my pronouns, or you're misgendering me. That's an offensive thing. That's akin to when somebody might have a slur, whether it's a female slur or a racial slur or a religious slur. When you misgender people, sometimes it's by accident. It happens. We slip up. I've slipped up. We all, it's not intentional a lot of times. Some people do it as a means of harm and as disrespect to say to their face that, you know, even though you identify as a woman, you're a man to me. That is unacceptable. It's wrong. So the terms we use for a transgender woman, like what you guys are getting, she and her, very simple, she and her. A transgender man, he, him, his, in the documents. I have heard, and I think a lot of us, if not all of us, we've heard people say it. We've heard people say that. We've heard people say thing, shim, he, she. No, that has to be completely off the table. We cannot allow that type of behavior. If they can be disrespected, what stops them from disrespecting us or anyone else? Like, we cannot allow that. Even if we have our own personal biases and beliefs, we cannot allow people to be called an it or thing or he, she. That's just unacceptable. It's not funny, and it's late, as they might say, which is another term. It's late. That means it's bad. It's old. People don't do that anymore. So just continue. People who need reminders though, like, you know, especially depending on how the individual presents, because some transgender women present gender expression, as we were discussing earlier, they present more masculine. And so sometimes what you see versus what they identify with might not match up. Mm-hmm. And so you have to kind of check yourself. You know what I'm saying? Mm-hmm. That's a little difficult to remember too. It's like, okay, you know, she may present more masculine, but she is a woman. Just pretend like it's anybody else, that you don't know what's going on beneath their clothes. But they, you know, they told you they're a woman and that's what they are. Do not demean, even when you think you're trying to motivate them. Again, like I said, a lot of people have good intentions and they don't mean any harm. But when you say stuff to a transgender woman, like act like a lady or man up, that's hateful and it's hurtful, and it's one of those microaggressions that slowly kind of tick away and break down people, who they are and their sense of self and worth. So remember, we can't say stuff like that. Well, you're supposed to be acting like a lady. You don't act like I've heard people say that. If a transgender woman or a transgender man isn't acting tough enough, well, why don't you man up? That's just like a subtle sign of like, what are you trying to say to me? Like, am I not, you know what I mean? So if there were a transgender man is saying you're not man enough, you don't belong, or if your transgender woman is saying you're not a woman at all, you should have man, like, so we have to be careful. These are things that we grew up saying, some of us, like, and we don't even realize how hurtful and offensive they are. So I would put those on our radar early, and on the staff's radar early, just so that they're prepared. Like, oh, I have to watch certain things. And it's not to make anyone feel policed. It's just to make people understand that sometimes you have to learn how to respect people. It's not just a natural thing for everybody. It's a process. We have to learn the right things to say. Like, you know, there were times where certain words that we use, we didn't know any better. We just didn't. And we had no ill intentions. And now you know. I think I'm almost done here. This video, it wasn't interesting. I'm going to include it. I'm going to send it to you, Deb. I think I sent the whole presentation, but it's basically a spoken word from a transgender man. So this is somebody who was born female and she transitioned to a male. So it's a very good spoken word poem that kind of describes like her experiences. But since you guys can't hear it, I'm not going to play it.
Okay. And then, since we're going to be sending this out to the staff, I want to make sure that the staff actually does review this, because I think there was a lot of really good information that was presented. And it is something that, you know, I want to make sure that we are a trial site for the DOC. This is the first time that they are doing something like this. And I want to make sure that we can try to be as successful as we can be. So are you able to just also send me a little quiz based on some?
Oh, yeah. You know, I like doing quizzes, Deb.
And then that way you'll know that they do have to watch it in order to get credit for this. Okay.
Okay, no problem. I'll send that to you. And if you guys have any questions, I'm not an expert. I'm just an ally with some experiences. And so I'm learning too every day. There's new things that I learned, like I was saying earlier. If I said anything that you guys might have said, no, that's not correct, or let me know, give me that feedback. I appreciate it. And I don't mind being wrong. I always tell my staff here, I do not mind being wrong. Tell me. So if you guys have anything that you can think of, y'all, Deb has my contact information. You can call me and you can email me as well with any questions or concerns. And it's a very long research report, but if you're interested, I can send that too.
Okay, well, thank you. This was really informative, and we will be, as I said, probably using this too for other facilities, because I think more and more we're all going to be having to put aside our biases so that we can make it, ensure therapeutic environment for these individuals.
100%.
I'm getting a cold.
Yes, I see.
I
All
don't
right,
have a cold,
guys.
I'm getting a cold. Okay, thank you very much.
Thank you very much. That was very good.
Thank you. Y'all have a good rest of y'all day, okay?
Okay,
Thank
Roxy,
you.
email me that stuff. Email me that stuff, Roxy, okay?
Yep, sure will.
No, I mean, Roxy,
Oh, right.
yeah, email me, fax me that stuff that you have, okay?
Yes, I
Thank
will.
you.
Thanks. All right, bye-bye.
Bye.
Bye, thank you.